Hello everyone, my name is Ruoping Zhang. In today's presentation, I will be discussing the application of Orem's self-care deficit nursing theory, SCDNT, in both ICU and family nurse practitioner practice. This theory has significant relevance at all levels of nursing in clinical settings, where self-care deficits are relevant, partially in intensive care and chronic disease management. I choose Orem's self-care deficit nursing theory for this presentation because it directly applies to my current nursing practice in the ICU and the future FNP settings. In the ICU, patients often face significant self-care deficits due to intubation, sedation, and their critical illness. Orem's theory emphasizes the importance of self-care, and when this is lacking, the nurse's intervention to support recovery. Additionally, for family nurse practitioner, the focus shifts to chronic disease management. This is where the supportive educative system comes in. Managing disease like diabetes or hypertension is a long-term, partially dependent self-care challenge. Overall, this theory complements my personal nursing philosophy is to empower patients to regain the ability to manage their health and daily activity independently. Orem's self-care deficit nursing theory was developed by Dorothea Orem in 1995. Her theory is actually compilation of three interconnected theories known collectively as the self-care deficit nursing theory. Orem's theory focuses on three key concepts: self-care, which is the action people take to maintain their life and well-being; self-care agency, SCA, which is the person's ability to perform those actions; and self-care deficit, which is the core concept that when nursing is required, it assesses when the patient's self-care agency is less than their self-care demand. Orem's theory is applied through three nursing systems, which can be adapted to both acute care settings like the ICU and the primary care settings, such as those in family practice. This slide outlines for the four fundamental theories of SCDNT. The theory of self-care defines what a patient should be doing, such as meeting their universal self-care requisites, including bathing, eating, and hygiene. The theory of self-care agency is the patient's power or ability to perform the self-care required. For example, a patient with a fresh hip replacement physically cannot bend to put on their socks. This point links to how nursing helps strain a patient's ability to perform self-care. When self-care is not possible, the theory of self-care deficit states the trigger for nursing interventions. Finally, the theory of nursing system outlines three levels of nursing intervention, tells us how much and what type of intervention is needed, which is key to guide our actual practice. The three nursing systems provide a clear, definable role for nurse and nursing interventions based on the severity of deficits. The wholly compensatory system is seen in critical care, where the patients cannot care for themselves, such in the ICU. Patient being unconscious, intubated, or completely paralyzed. The nurse provides total care. The partially compensatory system is a partnership. It is common in the recovery phase. The patient can perform some self-care tasks but needs assistance, such as post-operative or post-extubation. The nurse manages complex tasks like medications, wound care, or help them safely ambulated. At the same time, the patient performs some tasks they can do, such as feeding self, cleaning their face, or repositioning themselves. The supportive educative system is highly relevant for primary care and chronic disease management, where the patient performs all self-care but requires education, counseling, and guidance. For example, teaching a newly diagnosed diabetes patient how to monitor their blood sugar, adjust their diet, and manage sick days. The nurse's primary role here is to support to enhance the patient's accessing agency. In my FNP practice, this will be the most common system I utilize. This distinction allows nursing care to be individualized and precise, move the patient toward maximum self-care. Now, let us evaluate the theory against professional criteria. SCDNT is fully congruent with current nursing students, such as the ANA standards of practice. Before an intervention is planned, a systematic assessment of the self-care deficit is conducted, which emphasizes patient-centered care. It also aligns with the current nursing interventions and the nursing process. The assessment identifies the self-care deficit, which leads to individualized interventions according to the patient according to the three nursing systems and patient education. The evaluation measures the patient's progress toward meeting their self-care demands. Orem's theory is one of the most widely tested. As Hardwick and Metcalf noted, it demonstrates its validity and accuracy as the predictor of the nursing needs in various clinical settings, showing that it improves patients' outcomes in both the ICU and chronic disease management. Orem's theory is widely used as a framework for nursing curricula, as a principal guide for discharging in administration, to ensure the patient or caregiver is prepared to meet their self-care demands. Also, it is a subject for nursing research. The need for self-care is universal. The series allows for individualized interventions that take into account a patient's cultural values and experience. For example, dietary habits or spiritual practice. The client-specific assessment prevents cultural imposition, making it incredibly flexible. Its major contribution to the discipline is providing a structured and measurable framework. It moves nursing from a task-oriented profession to a science-based systematic discipline that a nurse can use to assess, diagnose the deficit, and determine the appropriate interventions within the nursing systems. For my personal practice, Orem's theory provides a clear, defensible rationale that ensure I'm always being intentional for every intervention. Whether I'm wholly caring for an ICU patient or simply guiding patients through the process of self-care, the theory forced me to make calculated, theory-driven decisions about how much and what kind of care to provide. It ultimately empowers patients to regain independence when possible, and it is the most appropriate use of nursing resource. Thank you for your attention. I will leave you with this final thought. Think about a patient you cared for today. Which of Orem's 3 systems did you use to guide your practice? These are the references that supported this presentation. I welcome any questions.